Thank you everyone for joining us today. This is the Faith and Community Engagement, how HIV is informing COVID-19 vaccine research. But this webinar is being hosted by the Inter-CFAR Faith and Spirituality Research Collaborative. My name is Louis Shackelford. I work at the Legacy Project in the Office of HIV/AIDS Network Coordination, and I'll be your moderators for the webinar today. Not to belabor the point, I'd like to go ahead and get started with the webinar. So first and foremost, I wanted to have a moment of silence, considering everything that's going on in the world today. We wanted to have a moment of silence for all those who have been the victims of police violence and brutality, and have lost and some who have lost their lives as a result. So, considering everything going on in the world and people who have endured violence like George Floyd, Breonna Taylor, Eric Garner, Jacob Blake, and so many others that we can't name at this time. So we wanted to go ahead and have a moment of silence, and I'll start that moment of silence starting now. Thank you. So this being a webinar centered around faith and spirituality and people of faith and spirituality, it would be remiss if we didn't start off without a moment of prayer. So for this, I'm going to turn to our esteemed Reverend Sanders. Reverend Sanders, can you please lead us in a brief moment of prayer?
Sure. As we assume our various postures of prayer, we just ask that the Spirit of the living God would clearly move in our midst in a way that allows us, in spite of what might be distance, to know that we are joined as one in a spirit that represents a desire, an intent, a will to respond to this crisis in a way that will allow the horror that has in some way come to be a part of it to be resolved. And every one of us will come to this moment with open hearts and open minds. We know that you are a God who we might know by many names, but we know that your character is always such that justice and that which is peace and unconditional love is always at the heart of everything that you represent. So touch every word that we speak, every thought that we think, and everything that we do. In the name we pray. Amen.
Amen. Thank you, Reverend Sanders. So as the COVID-19 pandemic continues to upend every aspect of our lives, researchers are working around the clock to find a vaccine. To confront this new pandemic, researchers are increasingly utilizing knowledge and lessons learned from the ongoing HIV epidemic to pave a way forward. The powerful advocacy of people living with HIV and affected by HIV has created new paradigms in community engagement and research in culturally responsive science. Just as in the HIV epidemic, faith communities play an important role in combating the COVID-19 pandemic. We've assembled a great set of speakers who can speak to both the ongoing efforts in HIV community engagement and awareness and the science that's combating and preventing HIV all across the world. At the same time, many of these experts have their hands in the COVID-19 research that's going on, particularly the COVID-19 vaccine research that's been going on. For those who may not know, a lot of the resources in HIV research, especially HIV vaccine research, have now been pulled into COVID-19 research. So there's a lot of synergy, there's a lot of learning that's been going on. And of course, as with the HIV epidemic, where we've seen faith communities play a big role in combating HIV, there is definitely a role for faith communities in the fight to end the COVID-19 pandemic. And that's what we're going to get to the heart of today. So again, my name is Louis Shackelford. I'm project manager at the Legacy Project in the Office of HIV/AIDS Network Coordination. My work centers around increasing representation of underrepresented, underserved populations in HIV research. So this are populations such as Black people, Latinx people, Native folks, um, populations that are traditionally underserved by medicine and definitely underserved by medical research. So my co-panelists today, who will be taking us to the end of the webinar, and I'll be handing off duties to her as we go through the Q&A, is Delara Uscoop, Dr. Delara Uscoop. Delara Uscoop is a postdoctoral fellow at UCLA, and she works at the UCLA Center for HIV Identification, Prevention, and Treatment Services. So Dr. Uscoop holds a PhD in both theology and political science. And I'm so happy to have her on as my co-moderator. And she is wonderful. And I can't wait for you all to hear from her. First and foremost, we have our speaker that you've already heard, Reverend Sanders. Reverend Sanders is the senior servant and founder of Metropolitan Interdenominational Church in Nashville, Tennessee. So Reverend Sanders is the leading faith ambassador for the HIV Vaccine Trials Network and COVID-19 Prevention Network. Reverend Sanders also serves on the President's Emergency Plan for AIDS Relief, called PEPFAR, Scientific Advisory Board, and boards of the National Minority AIDS Council, also called NMAC, and the Drug Policy Alliance, and the Black AIDS Institute. So next we have Dr. Michelle Andrasik. Dr. Michelle Andrasik is the Director of Social Behavioral Sciences and Community Engagement at the HIV Vaccine Trials Network and the the COVID-19 Prevention Network. She's also a senior staff scientist in vaccine and infectious disease in the vaccine infectious disease division at Fred Hutchinson Cancer Research Center, and she's also a clinical assistant professor in global health at the University of Washington. And Dr. Andrasik's work focus on addressing social and structural factors associated with HIV risk and STI disparities among marginalized communities in the United States. And moving on, we have the esteemed Dr. James Hildreth. Dr. Hildreth is the 12th President and Chief Executive Officer of Meharry Medical College. And Dr. Hildreth began his career in research on HIV and AIDS in 1986. And his research has been funded through the NIH grants for almost 2 decades. His work focuses on the role of host proteins and lipids in HIV infection. Next, we have Dr. Tamara Taggart. Dr. Taggart is at the DC-CFAR. She's an investigator and assistant professor in the Department of Prevention and Community Health at the Milken Institute School of Public Health at George Washington University. Dr. Taggart conducts social epidemiologic studies to examine the cultural and the contextual and cultural determinants of health, and then uses CBR, community-based participatory research methods, to develop and implement interventions to reduce HIV risk and substance use among racial and ethnic minorities and socioeconomically disadvantaged adolescents and emerging adults. Last but not least, we have Dr. Bonnie Graham, who's the Deputy Director of the Vaccine Research Center. He's also the Chief of Vaccine and Pathogenesis Laboratory and Translational. He focuses on vaccine and monoclonal antibody development for COVID-19, influenza, Zika, HIV, Ebola, and other viral emerging pathogens. So we have a broad and deep well of experience to call on for our panelists today, and we're so excited to have all of our panelists on the webinar today. And so now I'd like to move forward with our discussion. So first and foremost, and I'm going to open this up for everyone on the panel to chime in. So how might faith and spiritual communities address how we acknowledge structural racism in tackling racial disparities apparent in COVID-19? And this is open to anyone on the panel. Please don't be shy.
You'll need to unmute.
Well, yeah, suggest one or two things that I think will maybe start us on the path or give us a robust conversation for this question. I think one of the things that's very important is to appreciate the ways in which the dynamics of racism end up being a point of intersection for so much of what's going on in our society. It's always a disservice if we look at our scale and somehow not understand that they all have implication and meaning in terms of the way in which we are trying to address the issue of COVID-19. It's not, I mean, it was important to me today when you started by your moment of silence, for indeed, all of what's going on in terms of the violence, in terms of the lives that are being snuffed out, in terms of the ways in which there are the disparities that manifest themselves in terms of healthcare and in terms of all the other kinds of opportunities that we would like to think of as being a part of the framework of life for all in our society that just aren't there. So the first thing is to appreciate that you have to look at all of the institutions. So if it's institutional, if it's structural, if it's systemic, there's a way in which all the systems and all of the structures and all of the ways in which we look at life, we have to figure out what role do they play and where's the point of connection with what we're trying to address in terms of COVID-19. We clearly know that right now in terms of what evidence shows us in terms of the vulnerability that seems to be greater amongst people who have certain underlying health issues. And we know that those same underlying health issues are very much related to systemic and institutional and structural realities that compromise the quality of life for the people who now are being most disproportionately impacted by COVID-19. So it's one thing, it's one fabric, and there's a way in which I think when we approach the issue, if we don't have ourselves postured where we are looking at the issue in that kind of fashion, we probably do a disservice. It's not a single issue kind of reality, but rather it is an issue that's at the heart of very much all of what is undermining and creating the reality of the marginalization of those people that we're trying to speak about and to right now.
Thank you, Reverend Sanders. I will follow up on that. One of the main points that we are focusing on are our own implicit biases and how they play out in the way we communicate, the messages that we have, and more importantly, who we decide to screen and enroll in our trials. And so really pointing out the impact of bias on decisions and ensuring that our investigators and site staff and all of the individuals working at our institutions are not only aware of biases and how they're connected to inequities in health, but also have the tools and strategies to ensure that our biases have minimal impact on the behaviors that will result in people of color participating in these trials and just participating in research generally.
I think I echo the comments that were just previously made, and I want to add the importance of, making sure that we're thinking about ways in which we can continue to develop and push policy forward to truly address structural racism. The racial disparities and disparities that we see in COVID-19 are very much in line and replicated in other health conditions throughout the US. And so, thinking about when we want to tackle structural racism, really pushing forward and pushing for those policy changes that are driven around, economic empowerment, housing stability, neighborhood factors, strengthening communities that we know affect disparities across health conditions and outcomes, not just COVID-19. And, I think we can use this opportunity as a time to shed light to those policy factors and those larger social determinants, and really use this time when people's minds are perhaps more open and reticent and ready to receive that type of thinking about health.
Absolutely. Absolutely. Any other comments from my panel? All right. Well, thank you for all those great insights. I think I agree with everything that was said. This is a very powerful moment for us in our country, and definitely in science and research in general, where we've been called to task to surmount this pandemic. But we also know that in the midst of this, we've continued to deal with another epidemic that many of us have been called to serve in combating in that fight, which is HIV. So can we talk a little bit more about what lessons, what have we learned from the fight to combat HIV that are informing how we move forward in combating the COVID-19 pandemic? Would anybody like to speak on that?
Well, I guess the thing that I would say is that in my work at Meharry, when I came here the first time around and partnered with Reverend Sanders and HIV awareness in the community, how important it was to have trusted messengers. That if we're going to have an impact and have people accept vaccines and be part of trials and do the other things that are necessary, it's critically important that we have people delivering those messages and trying to get people involved who they trust. And that became very, very clear in the work in HIV. And I think the same thing is true here in COVID-19, that there's a lot of misinformation out there and people are looking to the wrong sources for information. So I think it's really important that we have trusted messengers and opinion leaders that can help us get those messages to those that need to hear them. So that's one lesson I would say from what we learned.
I can say something. I've been involved in HIV work for a long time. I saw the first AIDS patient in Tennessee when I was a chief resident at General Hospital in Nashville. And then we also started the first vaccine clinical trials program for HIV vaccines back in 1987. That's when Reverend Saunders' daughter and my daughter were just entering kindergarten together back in Nashville. And so we've been at this together for a very long time. And there are some scientific types of things that HIV has been very important for informing the current coronavirus research, including structure-based vaccine design that's gone from HIV to RSV, now to coronavirus, and now reinforming HIV types of approaches to making vaccines. But maybe more importantly for this conversation, the experiences with trying to interact with community around HIV vaccine volunteerism are echoed now in what we're trying to do with coronavirus vaccine volunteerism. And Reverend Saunders and I have had many conversations over the last few decades about how, fact-based approaches to communication are relatively ineffective when you're trying to transcend belief systems or faith systems that are recognizing a greater truth that the facts for the immediate problem don't really address very well. And so we have framed it as a fact versus faith conundrum over the years that I think is something I still think about a lot. And I think it's something we have to overcome in the way we communicate our science facts with communicating through some of those larger truths that still exist that don't really are not really addressed by the facts.
Absolutely. So, Reverend Sanders, your name came up, I think, twice there. Anything you'd like to add?
Well, I guess most of you that have seen my talks and presentations have heard me make reference to the dynamic of how it is that bias, implicit, explicit bias, are both the byproduct of what I paint a larger picture of, speaking of, as what I call dysfunctional belief systems. It's an interesting way to think about an intersection between the science and spirituality, because what happens is that there's a broad swatch, I guess, a broad stroke that in which there are beliefs that have come to be so much part of the fabric of the thought process of our society, just in terms of not just the things that are most obvious in terms of external, recognition of difference in a way that has categorized people as being, for one reason or another, less, I guess, lives as being less meaningful and less significant. But if you think of you could go through the whole lexicon of measures that you can use in terms of how people make superficial observations with regard to race, especially people of color. There's a way in which all of that carries over. I talk about it in terms very often of being functional versus dysfunctional belief systems, because, what you believe is probably the most powerful thing at work in your life. And if indeed those beliefs have come to be grounded in that which is less what the truth is, less than what the truth is regarding human beings and what indeed represents, the character, what represents that which frames human beings beyond that which is obvious on a physiological level. If you aren't able to think in terms that take you to that next level of understanding, to the ways in which all of even what we think about in terms of our senses end up having another dimension to them, then there's a way in which we find ourselves running into a stumbling block in terms of our ability to completely discern and decipher what it is that we're dealing with, because it ends up being more than most of what we have any physiological capacity to understand.
Thank you. So I'm hearing things about trusted voices. I'm hearing things about faith versus facts. I'm hearing about bias and different dimensions of faith that go along with that. So it sounds like we're already leaning into this conversation about faith and spirituality, because these are all things that faith communities are intrinsically familiar with. So I'd just like to open it up to the panel to talk about what is the role of faith-based organizations in applying lessons learned from HIV, from HIV community engagement and research during the COVID-19 pandemic. And I know that we have folks on the panel who have done work in terms of that intersection between HIV and faith communities. We have folks on the panel who are leading community engagement efforts in the COVID-19 prevention network as well. So what do you think how can you think faith communities can lend their voice, lend their support in substantial ways to the movement to combat the COVID-19?
So I can start. So I have quite a bit of research around working with faith communities and implementing HIV prevention interventions. And so thinking again about Reverend Sanders' comments, I'm automatically thinking about interventions to address stigma. You know, I think there's been, when I think about some of the ways COVID-19 has been described, and I won't go into them, but I think we can all think about some of the terms that have been used for the disease itself and for people who are going through COVID. I can't help but think also about some of those parallels around HIV stigma, and really thinking about what are some of the interventions that we may be able to utilize and that have been used and have been successful, especially with working with faith communities to address stigma at a real community level. So I think that's one comment that comes to mind. And then the second is one that, as we think about this time, it's really this space of kind of grieving and a time of hopelessness and a time of feeling loss. And a lot of the messaging and messages that are coming out now aren't necessarily, they're kind of supporting that feeling versus providing resources and sources of strength. And so I think this is an opportunity in a space where faith communities are able to provide that support, to provide, coping and provide resources, to remind communities of their resiliency that's within, community structures and, of the spaces that remained as a place of hope. And I just think that's very important right now, with so much that's occurring, within this country and beyond, that we really uplift a place of hope and a place of where faith and spirituality can support that.
Absolutely.
I see the church or faith-based organizations as being the translator or interpreter, one to the other, going back between scientists and going back between community, because as I was saying before, the facts don't really matter if you don't communicate at the different level. The question I ask people is, how do you know something? And one way is to know it by your head and what you've learned. But the other way to know it is, at a deeper spiritual faith or soul level. And if you don't communicate in both ways, the communication won't be effective. And so that's what I meant earlier, just providing a set of facts about X number of people will make X number of immune response doesn't really give a person trust when they know that at a different level, they've been misled or miscommunicated to by government sources or other sources, and the outcomes have not been good. And so until you can communicate at that level, it's hard to communicate that. And I think the faith-based organizations have at least as an example, between me and Reverend Saunders, we've been able to connect at different levels to communicate effectively, going back to both sides of this.
I would just add to what Barney said that some people call them sermons. I don't call them that because I'm not a minister, but one of the talks I give is about not letting what you learn negate what you know. And it's exactly what Barney is saying. But there are some things we know instinctively that no matter what anyone tells us, we know it's not quite right, because we know better in our heart and in our souls. And one of my biggest disappointments has been 180,000 people are dead. Most of them look like me, either brown or black. And I wondered whether or not, if they looked differently than that, would the nation be more galvanized to do something? Because it's just it's very disheartening, disillusioning, and otherwise for me to know that that many people have died. Some of those deaths could have been prevented, and you wonder whether or not it's because they are who they are, and whether or not some lives matter less than others. And I've been disappointed by the church writ large of not leading the outcry to leaders about how unacceptable this is. Present company notwithstanding. So that's been one of my biggest disappointments, that despite the death toll and the decimation to certain communities, that the nation as a whole has not seen this as the urgent crisis that I see it, that we see it, those in the medical community. And part of it is, of course, because some folks in certain faith communities seem to believe that our current leader, there's a disconnect. And I'll just leave it there.
Thank you for bringing up that point, Dr. Hildreth. I think it's extremely important that we discuss that, because I think it's on a lot of people's minds, especially communities of color, about what would this epidemic, or what would the response to this epidemic look like if the populations predominantly affected were not communities of color. So in that regard, I wanted to see if we can go to Dr. Andrasik and talk about some of the ways that the COVID-PN is addressing how to incorporate communities of color and make sure that they're not forgotten in our efforts to do COVID-19 vaccine research. Dr. Andrasik, do you think you can speak to that?
Sure, and I just want to say thank you to Dr. Hildreth. As someone who's been doing HIV research since the early 90s, that question has often crossed my mind with regard to HIV research. If people who were most impacted look differently, would we see it as more of a crisis? And so I feel as though that same issue is now loud and clear in COVID, and feel that it would be with any disease that differentially impacts communities that have devalued identities. And we are working incredibly hard to reach out to communities. We're working with Reverend Sanders, who is leading a phenomenal faith-based initiative, which is going to launch soon, including faith ambassadors and clergy consultants across the U.S., and really utilizing what Reverend Sanders had pointed out before, the importance of merging science and faith belief systems, and really utilizing the infrastructure of faith-based organizations to engage communities. And our focus in everything we do is to ensure that communities have the information they need, have the resources that are required to make informed decisions about their health, their own health, the health of their families, the health of their communities, and whether or not that results in them participating. They have the information to ensure that they can make a decision. And so besides the faith-based, or in addition to the faith-based initiative, we are working very closely with Stefan Wallace, who is our Director of External Relations to reach out to grassroots organizations, local organizations, and national organizations, partnering with them to identify what information is needed, how to communicate that to individuals. We're working with the National Urban League. This week, I've been in touch with the YMCA, the YWCA, to identify how to distribute materials to individuals in their housing complexes, what webinars we might need, listening sessions to really get the information into individuals' hands. Well, I think one of the biggest battles we have, as some of the panel members have mentioned, is the pervasive myths and misinformation that are in our communities that are driving a lot of the fears and uncertainty. Dr. Hildreth mentioned some of that tied to current leadership and how we can get out in front of that. And right now we're behind it, very much so. And so, making sure we address the fears. Some of the fears that we've heard are, how are you moving so quickly and not compromising safety and not cutting corners? So we need to explain how we are expediting the research process, and for those of us who are in it, I think it's easy to see how it's being expedited, but we are now working to communicate how we're overlapping processes and the structures that are in place to ensure safety and getting that out into communities. And so far what we've have is written materials, but we're working incredibly quickly to produce short videos to explain that as well. That'll be up on the COVID Prevention Network website, as well as disseminated to local organizations and sites so that they can utilize that in their engagement with communities. One of the other main fears that we're trying to address is the sense that we're targeting people of color. And we're trying to explain the importance of including everyone in these research efforts and what it means if people are not included in terms of finding an effective vaccine that works for the most impacted communities. And as I said, we're racing to catch up to all of the myths and misinformation that are out there, and really working to partner with community organizations, ones that we have long-standing partnerships with, and then also reaching out to community organizations with whom we need to develop relationships.
And Dr. Drastic, if I could just follow up, and some of this is anticipating the questions that I have forthcoming, but I just have taken some headlines from the news as a political scientist and as a person working in public health. I'm very much thinking about how the politics, how religion, and how public health are all intersecting at this critical moment. And so as you talk about the operation, as you kind of in some ways talk about the Operation Warp Speed and talk about the vaccine fast tracking, there's some, and I'm just going to read the headlines. For instance, there have been some things happening around blood plasma this week. And one of the headlines from the news is FDA's, and they're talking about Dr. Hahn, apologizes for overselling plasma's benefits as COVID-19 treatment. Another headline, another title ripped from the headlines. COVID-19 vaccine may pit science against politics. Another one. Scientists worry FDA could be pressured to approve COVID-19 vaccine before it's fully tested. So while I am thankful that these materials are being prepared and these videos are being prepared, I want to be able to steer, and maybe this is and I'm turning this into a question that I'm going to loop back to at the end of toward the end of our discussion, but these are credible headlines that have been coming from credible news sources, from leadership, from the scientists who are behind some of these vaccine trials and efforts. at not only our federal institutions, but are at the clinical sites. And so how do we address that? And while there is misinformation out there and disinformation out there, there's credible information out there too around mistrust from our very from the science community. And so how if you could just kind of address, as people are seeing these headlines that are just popping up day to day, and and these kind of outcries from the scientific community, can you just kind of outline what processes are in place, and if you can kind of just to kind of mitigate some of these concerns, but then also to address some of the concerns that even the scientific community has about the research that's happening right
Mm.
So I can address some of them, but I think some of the other scientists here might be better suited to chime in as well. One of the things that we're really focusing on is the safety data and monitoring systems that we have in place. And so we have a very robust system of individual scientists who are not connected to any government institution, who monitors these trials and makes decisions with regard to safety based on the data. It's all based on data. And these, as I said, are independent review boards. So we really focus on that. And we also focus on the fact that we are looking at the data with an eye on safety. And we have steps in place, including the FDA, which is not just one person who made those comments, but a group of individuals who make, decisions based on public health and safety. So there are mechanisms in place. And Barney, I see you moving forward, and I think you are probably in the better position. Do you want to speak about that as well? Not to put you on the spot, Dr. Graham.
Sure. Well, I can talk about it. I mean, one of the problems is even among scientists and physicians, they often think with their belief systems more than the facts themselves. So they have their own preconceived notions, and
Right.
and they're one of the greatest determinants of whether a person will trust and take a vaccine, for instance, is based on their local healthcare provider's opinion. And during HIV vaccine development efforts back, as I said, 30 years ago, trying to convince local physicians that what we were doing was important and safe and scientifically sound and had a chance of working, there was a lot of mistrust, even among healthcare providers. So it's not just the community of lay people, it's the community of scientists that actually have to be brought along. And one of the problems too then is this 24-hour news cycle. It's not hard to find somebody with a conflict or a hidden agenda of their own to press things into one direction or another and away from something that might actually be credible. So this misinformation and misdirection is happening in a lot of different areas, and we have to educate our healthcare providers and scientists just as much as we have to educate the community.
And let me just add one more thing, which is that, I've been, I guess, doing science since I was a sophomore in college back in the late 70s. And there's never been the kind of political intrusion into science like we're seeing now. It's blatant. It's disappointing to me on several levels. Yes, just yesterday I had to tell the Nashville community that we're defying the recommendation made by the CDC regarding not testing asymptomatic individuals. That was clearly a political decision, not based in science, right? And many people are not aware that NIH withdrew a grant of a prominent investigator studying pandemic potential viruses in China because the work was being done in China. Okay. So when you have a politician who can direct the funding of science as opposed to the peer review process, we're in trouble, right? And I've never seen anything like this. And it's so blatant that it's hard to miss what we're living through. And I believe that many lives have been lost because of it. And again, I don't know what the answer is, but I do know you all need to know that that's a problem that we're dealing with. That for the first time in my lifetime, at least, there's an obvious intrusion of politics into science and to decisions that affect the health of the public. And it's a serious problem. So to me, that's also something we have to deal with.
And so if there are ways of being able to connect people who have the right information to the people who can communicate that information to the right communities, that can make a big difference. And I remember at the time back in the mid-90s when I was giving a talk to the African American AIDS group, and Reverend Saunders was in the audience, and he said, and so after I gave my talk on HIV vaccines, he said, well, Barney, would you give that to your daughter? Would you give that to Ann Margaret? Because our daughters did grow up together. And so that the question is, you have to reach the people who actually know the right information and not somebody who's speculating on it. And then you have to ask it in a way that makes sure that whoever is answering the question actually cares about the people who are going to be getting this next the product. And so you have to connect the care to the information. And if you're missing either one of those things, then you might as well just ignore the whole conversation.
And that's one of the reasons why back in March, some of us knew that this was going to be a huge problem for Black folks and minority communities from the very beginning. Because even in China, in the earliest days of this pandemic, China is a racially homogeneous country. But even there, if you had hypertension, diabetes, if you smoked and had some other conditions, people got much sicker and were likely to die. What would that look like in the United States? Well, which population has all those things for the most part in large numbers? That's us. So one of the first things I did was to ask to speak to the IMF. This is the local organization of Black church leaders. They're not all Black, I'm sorry, but they're church leaders, for the express purpose of telling them that we need to communicate to our people those steps to protect themselves, because it was becoming obvious that if we didn't do that, if we didn't have trusted messengers, we'd be in even deeper trouble. So that's why that was one of the first things that I did in my efforts in COVID-19, was to have a conversation with those I knew to be trusted leaders, trying to get them to trust me as a messenger about the things they needed to do to protect the population, the people that we are caring for, and they did that. And hopefully that made a difference, but my point is exactly what Barney said, that if you don't find a way to connect accurate information to the people who are trusted, it's not going to be very effective. And I think that's what I started with because it's so important. It's really, really important.
Absolutely.
Yeah. I think that these last comments, though, are really at the heart of our conversation today, because the first thing that we're getting to, and I guess I want to say it just kind of directly, it's a two-way street. In some instances, people will deal with the whole question of developing, saying there's distrust in the communities being most impacted. That there are people whose reluctance is born out of their fears and the like. Well, the fact is, out of that equation is trustworthiness. So on the scientific side, the issue ends up being the evidence of being trustworthy. One of the things I say very often in that regard is that, well, let me give you just a quick example. When I first began to work with the Vaccine Trial Network, I guess it's now been at least 12 years ago, and even earlier than that, I was doing some indirect things because Barney convinced me to be a part of the Community Advisory Board at a point when I was not sure about vaccines. And that goes all the way back to somewhere in the 90s. But anyway, what happened though is that when I was asked to come and try to begin what was, and Lewis, I know you know this history, that the Legacy Project started as a result of us raising questions that are very similar to the questions that we're raising right now with regard to vaccine research. And that was, how would we get a much clearer picture and a much breadth of perspective in terms of people that were being disproportionately impacted, involved at every level. And I think there have been some progress in that regard. But I think about some little things. For instance, I remember thinking about the fact that one of the components of Legacy was what we call the RAMP scholars. One of the things that was intended there, and Barney, our theory did not work in this regard, because we decided 12 years ago that we focused on trying to get young people who were in high school who were interested in the sciences on a path that would lead them perhaps to being trained in a way that would allow them to be a part of the community of research. We decided 12 years was a timetable that meant that we would end up with some folks coming out of that pipeline that would be a part of this conversation. Well, the fact is, it evolved in that way. There's very sound research that was done back in the late 80s and early 90s that indicated that there was a distinct value in having people who looked like those who were being most disproportionately impacted as a part of those who were developing the research, that were developing the strategies to respond to the crisis. I'm hoping that one thing we will get out of this for sure is an effort that gets ramped up in a way that will have sufficient momentum that it will carry us a lot further down the road, over against being another episode where a crisis comes, we pour effort and resource into trying to deal with it, but it goes away. It's kind of like the syndrome of syphilis. I spent a lot of time dealing with the syphilis elimination question. And one of the is that, syphilis became cyclical primarily because there was always a period of time when resources would be poured into it, and then it would fade. And when it faded, the vigilance in terms of staying on top of the issue went away. I hope what we're doing now is building something that will have a foundation and will have a quality of integrity within it that will help us to be ahead of the issue instead of being, as I guess Martin Luther King said in one of his talks, I guess, be the headlight instead of the tail light, because it's important for us, I think, that the headlight in this whole arena of infectious disease and these things and all the issues that we're talking about that disproportionately impact, African Americans and other people of color. So I just want to say and to get to a spiritual emphasis in it. And I use Dr. King once again. It's amazing how people talk about the era associated with Dr. King's life as being the civil rights era. Dr. King liked to refer to the era as being the soul force era, the soul force movement, because what he was saying is that he knew that the idea of a few, facts that will translate into laws that allowed you to eat places, sleep places, and have those kinds of would not be sufficient in terms of turning the tide of the kind of atmosphere that creates the kind of racism that we're still dealing with today. If we do this well, we will be important players, important partners in the process that would be able to change the way in the pattern of perpetuation of the historical horrors, which Dr. Andrasik speaks to brilliantly, where she talks about the whole idea of historical trauma and all the manifestations of it that go back all the generations that we've been a part of this experience in this country. So what I'm saying is that this is a critical moment for us. It's a very important conversation, but I will tell you this. One of the reasons why this conversation is as rich as it is is because you do have voices that are part of this moment that need to be voices that are expanded in terms of those who carry the message. I kind of laugh when Dr. Hildreth made the comment that he's not the preacher, but you know, Dr. Hildreth is one of the few scientists that I know people welcome into the preachers welcome to the pulpit because he has. Yeah, well, it's the fact, you know, and that's important. I mean, Barney is a trusted voice that you know, we're talking about a time when we need to be about the business of cultivating more of what represents the foundation of what's not just going to take us through this drive-by moment in relationship to COVID-19, but what's going to take us much further down the road in terms of an ongoing sustained effort that meaningfully changes the tide in terms of the impact that's being had upon marginalized people of color.
Mm-hmm.
And Reverend Sanders, if I can interject really quickly, I'm so glad that you talked about building. We've heard a lot about scientists on this panel and what they're doing to build and to help push the narrative towards a place that's based on facts and not fear or just bias and misinformation. And I'm glad that we've made the statement that the narrative really isn't controlled in many different ways on this panel. I've heard the panelists pretty much say that the narrative isn't being controlled by scientists, you know, and all the headlines we see are not generated because scientists are pushing them forward, but there's a lot of misinformation and other things going on in the community. And so we need to lean on those trusted voices. And we've heard about trusted voices in the scientific community. But I wanted to just give you an opportunity, Reverend Sanders, as a trusted voice in the faith community to talk about and address some of what you've been doing in faith communities to address COVID-19 and to engage faith communities in COVID-19 research.
I think, Louis, the thing that I can say probably most succinctly is that our primary focus is making sure that we are effectively disseminating the kind of information that allows there to be a level of awareness for persons who have networks of relationships, especially. And when I say networks, I'm not talking about necessarily all of the mainstream networks that are out there. But when you start talking about faith communities, you realize that there are ways in which there are inroads into being disproportionately impacted that you really don't necessarily effectively reach in any of the mainstream fashion. So it is a matter of getting, and we haven't mentioned this at all, but this whole question of the fact that the issue is coming to be as prevalent in rural urban communities. The only way I know to effectively reach rural communities is through, you know, faith institutions that have networks of relationship. And if you can effectively influence those voices and those persons, and if they become the ones who are the messengers, we're trying to make sure we do that in our effort to target and to identify where we need to focus our efforts. The other thing is making sure, and this is, I just applaud what's happening with the COVID-19 in this regard, and that is to make sure that we incorporate the voices and the input of persons who can best help us develop the kinds of messages, the kinds of materials that will allow them to be most effectively received and most effectively impactful in terms of how we are able to a level of awareness. And my whole thing, I say it this way all the time, is just to make sure that people have the kind of information that allows them to make informed decisions. It's always going to be a decision in terms of whether or not you're involved in, you know, participation in the trials. But that decision can be made in a way that is not primarily driven by your fear, your apprehensions, and your doubts, but rather by your knowledge and your belief that what you're doing is something that can make a difference.
Absolutely. And as I turn over moderating duties to my esteemed co-moderator, Laura, I just want to remind everyone on the webinar that if you'd like to be a part of the discussion that we're having, we do have a chat box. If you have any questions in particular for our panelists, please feel free to submit those in the Q&A section of the webinar. We'd love to hear from you and love to incorporate your ideas and questions into the conversation. And with that, I'll turn it over to Delora.
Thank you. And I might be moving us along so we can get through as many questions, both from the audience, but that the planning committee has put together as possible as we kind of lean into the second half of this very robust discussion. And so I want to move to community mitigation. And when we talk about community mitigation activities, we're talking about actions that people and communities can take to slow the spread of a new virus with pandemic potential. And here we're talking about community mitigation as it results to COVID-19. So we know that there are some actions for the mitigation of the coronavirus, and this can include washing hands often, avoiding close contact with people who are sick, and practicing social distancing, covering one's mouth or nose with a cloth, with a cloth face cover or a mask when around others, covering sneezes and coughs and discarding that tissue, and cleaning and disinfecting frequently touched surfaces daily. However, as we talk about faith and spiritual communities and how they may address or assist community mitigation efforts or actions, we must also kind of consider the tension that exists, that there are faith and spiritual communities that have been doing the very opposite, right? That have been opening their churches. We have incidents of pastors who were holding services, and one of those pastors, who does quote unquote look like us, who was a person of color, transitioned to the infinite earlier this year because he had the corona, he tested positive and dealt with the challenges and fought, with having the coronavirus. And so, how do we consider community mitigation efforts for COVID-19, and how do we think about the role of faith and spiritual communities, but thinking about what we have seen unfold, which is that there seem to be these two camps: the camps of faith and spiritual communities that are adhering to guidelines and thinking about how to have church and other activities, other spiritual engagement in this kind of virtual platform or platforms that conform to these guidelines. And then the very opposite, where you have churches that have, and I'm thinking about a few churches in particular who have sued state governments for limiting in-person gatherings, and who have been doing the very opposite. So as we're talking about the role of community mitigation, I also want us to think about this tension that's existing in faith and spiritual communities themselves. So I know, Reverend Sanders, you touched a little bit upon the work that you've been doing, but I would love if you could kind of begin us with thinking about kind of community mitigation efforts from the part of faith and spiritual communities.
I know there are others who will speak to this, but let me just tell you, one of the things that we did, and this is a big we, because there's a woman who, Jackie Fleming Hampton, who coordinated the Project SAVE at Meharry Medical College. She was a woman who an initiative at Metropolitan Church. So we were blessed in Nashville that we had two CDC-funded capacity building initiatives. And this is to speak directly to your question. At Meharry, one of the things they did, and just in terms of mitigating, community response, they recognized that in the southeastern region of the United States, where there's always seeming a disproportionate impact of everything infectious and communicable, we realized that somewhere in the neighborhood of, and I might be, my statistics might be wrong on this, but somewhere in the neighborhood of approximately 40% of all African-American physicians in the Southeast had graduated from Meharry. They decided that what they wanted to do was and Dr. Hildreth might speak to this also, they decided to target those alumni. And because they realized that just about all of them went to church. So you had a very, tremendous opportunity to start from a point of communicating with some people who had some basic scientific knowledge. But the fact is, Meharry was a good example for that. But you probably can look and see that many of those folks who are people of color, who are in the healing arts, in the medical sciences, go to church. So I'm using that as an example because it gets to be important if you can get voices within a congregation or within a community or within even organizations. You can think about it in terms of these social service organizations as well, fraternities, sororities, and the like. There's a way in which we need to figure out how to convince those kinds of entities to raise this to a that would translate into another full array of partners that could be a part of helping us with regard to changing attitudes and enhancing the commitments of folks to do what we would hope they would do. As that's so basic. I mean, we're talking about some very basic and fundamental things that make a difference. But to the extent that that's not happening, it's probably because we aren't fully taking advantage of some avenues and relationships that we already have.
Dr. Hildreth, just want to provide you with an opportunity. I know earlier you said you didn't want to go there, you were going to leave it there, but I'm trying to take us there in this part of the conversation. Would you like to? I know your name and the work that was happening at Meharry came up, so I want to provide an opportunity for you to jump in.
Well, as Reverend Sanders says, Dr. Hampton worked at Meharry. She was actually one of my mentors, to be honest with you, in terms of how to engage communities. Because I've been a scientist up to that point without much experience in that. So Jackie sort of brought me along. It was her brilliant idea to try to identify Meharry alums who were church members and have them become ambassadors for us. It was brilliant and it worked really well. Thankfully, only the minority of faith leaders have chosen to open their churches. The majority of them have followed the guidelines and tried to keep their congregations safe. So thankfully that is the case. And to be honest with you, some of those individuals who made those decisions were actually rationalizing it as their rights being impinged upon. They had a right to gather, had a right to worship. Well, of course they do.
Right.
They also have an obligation, in my opinion, to protect those that are in their charge. So, but that just seems to be a theme running through this whole response to the pandemic, that politics, one way or the other, always rears its head and can complicate things. And so for me, leading a school that trains future providers of healthcare, of health or healthcare, I'm trying to make sure that I'm a good example for them. But I also believe that we're obligated, because of the oath we take, not to do harm, to speak out when we see something is not right. And so to me, that's what this is really about. And so thankfully, as I said, most of the faith leaders are abiding by the guidelines and are keeping their people safe. And the ones who are not doing it, to me, seem to be driven by politics more than anything else.
I would like to open it up if anyone else would like to offer a thought to this question or discussion item. Great.
So this may be a little tangential, but one of the things that I've noticed is, and this gets back to the intersection of politics and public health, is that even when communities have really been incredibly proactive about ensuring that their specific community is safe, those communities don't exist in a bubble, and they have to go to grocery stores or outside into the general public. And what we've found, particularly with people with communities of color, is that the leaders of those communities have been incredibly on point with regard to trying to protect their communities. But then, those communities go out into the larger society, and they are, in places where people are not, so mindful of their, risk of potentially transmitting COVID. I think a really excellent example of that is what happened with the Navajo Nation, where they implemented policies very early on and were incredibly proactive about protecting their communities. And the border towns were outright defying the policies that had been put in place, and so that had a huge impact on the health of the Navajo Nation. And now their community is being incredibly hard hit, and that's just one of many examples of how we as communities of color are at the mercy really of the larger community, and how people are really behaving.
And I want to lift up a comment that has been provided from an audience member, Michelle, that says, "This is such a great discussion." Reverend Sanders' comment on the only way to reach rural communities is through faith communities. So I also just want to lift up that comment, and as we move forward in thinking about the last few questions, if anyone else wants to add in other discussion on how we can also reach rural communities, which are also marginalized and under-resourced.
Mm-hmm.
So I know we've kind of talked quite a bit about the lack of certain voices in the discussion, analyses, research, and the proposals to mitigate the effects of COVID-19. But I do just want to provide a formal opportunity for anyone who wants to add in and jump in onto this discussion point in particular. So I do want to just open this question up.
Well, one consequence of these discussions Ed and I have had around fact versus faith over time is the idea that one part of it is why do people take over-the-counter herbal medicines instead of something that's been highly researched and verified to actually work? And it's often because it's framed in a way of hope. And they hope that it will work. And instead of just being told 70% chance of working, they are framed as something that could be hoped for. The substance of things hoped for. That's the faith part. And there's a way in which we probably need to do a better job of communicating things that can help replace belief systems instead of hammer people with facts. And so helping people to understand how a vaccine is made, how it works, gives them a new way of thinking about it that they can now believe in. They can believe in the vaccine because they can actually see how it works. That's one of the reasons I like structure-based vaccine design, because you can hold it in your hand and you can show people what it looks like, and it makes sense. And so trying to get to the point of communicating things that can help replace people's belief system in things that they can hope for, instead of just hammering with facts and expecting them to swallow it, is, I think, something we need to keep in mind.
Absolutely. And thinking about that in this politically charged, highly politicized environment, Because in some cases, it is about, hope and people hoping. But then in other cases, we can point to examples where from the very upper echelons of our government, certain statements have been made that are far from the fact and far from the science. And so, this is just really a unique environment, unique political environment, and a unique environment, as Dr. Hildreth was pointing out to earlier, for doing science. We had another audience question that I want to, and kind of comment that I want to make sure that we include. And it looks like this is an individual that is coming in from South Africa. And this person is saying that the opening of churches is limited to 50 or less in attendance, but liquor stores are not limited as to how many people can buy liquor. And we can see some of those same examples here in the US, both on the front of certain spaces being limited, but then these large events still happening, even though the guidance has suggested to lessen those events. And then also in thinking about this question, I think there are different ways that we can kind of interpret this question, but there is a limiting of churches, but then again, people can buy liquor and engage, and even here we have liquor stores that are remaining open, and obviously that does not promote a healthy immune system. And so, how might we kind of consider this audience member's question or comment that is coming in from South Africa?
Well, I'm on the mayor's task force for COVID-19, and my job, as I understand it, is to try to make sure that people understand the science that underlies what the recommendations that we make. And the reason why large groups gatherings are not wise is because they create conditions for super spreader events in which one person might come with the virus, but several might leave with it based on what happens, right? And so that is a very different thing than going to a liquor store, buying a bottle of wine or whatever, and leaving. I mean, I understand the question of the effect of alcohol on your decision making. That's very important. There isn't an effect on the immune system, which I think would be minimal in this case for what we're talking about. So to me, this illustrates the point that I didn't make so well earlier, is that we need to do a better job of having people understand the basis for the decisions we're making, that they're grounded in research, that they're underpinned by data, that some people think the decisions are arbitrary, and that creates some problems. So I would say that the difference is that in one case, you're creating a condition that could lead to spread of the virus, but in another case, you don't have large gatherings in liquor stores. You have people in small numbers going in, making purchases and leaving. And that, to me, is the fundamental difference. But it all comes down to making sure people understand this is an airborne virus, unlike some of the others we've dealt with. And a lot of what we're recommending is understanding what that means. What does it mean that a virus is airborne? So that would be my answer to that question.
And maybe this person is thinking about just healthy lifestyles and healthy living. So I also want to underscore that point. It seemed like someone else was trying to jump in.
Well, to that point, the best thing people can do for their immune system is to eat a healthy diet and get some exercise now and then. That would do wonders for the immune system. Okay. So alcohol would be okay if it's done in moderation, but the best thing we can do as average individuals to keep our immune system strong is to eat a healthy diet, get some exercise, and just keep ourselves in good condition. That would keep the immune system tuned up.
Absolutely. As we wrap up, I want to give everyone an opportunity. If you had, given everything that we have discussed here, given structural racism, given the pandemic, the coronavirus, the COVID-19 pandemic that is happening, given the attention toward racial injustices at this current political moment with the movement for Black Lives, given what we know about HIV and what we have learned from HIV research, given the politics of science right now and the politicization of science right now, given all of those things, if you could say one thing, either to a faith leader or a person in one of these communities, if you could have a 15-second sentence that you could offer to folks, whether they're concerned about mistrust or disinformation or cost of a vaccine or accessibility of a vaccine, both here in the United States, but to some of our colleagues that might be calling in internationally or viewing this internationally, what would you say?
Well, in the context of HIV, I would just remind people that in the earliest days of HIV, the stigma against homosexuality was such that the President of the United States refused to provide funding for treatment or research. But the gay men on the West Coast especially educated themselves about how the virus was transmitted. They took it upon themselves to protect themselves, and among that group, they turned it around by their own actions, by the decisions they made. We can do the same thing. We know how this virus is spread. We know how to control it. And it's especially important in the minority communities that we take charge of this and protect ourselves. That's what I would say to our communities, that we do what was done by gay white men in the late 80s, early 90s, when they took control of the situation to protect themselves because it was clear the government was not going to do it for them.
And thank you for that, Dr. Hildreth. I was basically going to say the same thing. We have to act up and speak out.
I have a similar comment.
We in this situation it's clear that most people who get involved, especially in trials and the like, have done it. The stigmatizing effect that we were dealing with HIV was one that the public open declaration in that regard. But we're in which it's impacting our community. We are the people to carry messages that would have folks to understand this issue because of the ways in which they directly impacted. Have had reservation in terms of how you talked about the person in your family that was the same gender loving person who had contracted the disease. But now we're talking about grandmothers and grandfathers and aunts and uncles. And there's a way in which messengers, especially, I'm going to lean on ministers in this regard and preachers and people who have those audiences. One of the things that's very important is to make sure this is a part of every gathering you're in. We went through a moment at Metropolitan where I made a commitment that every Sunday, because what you find is that an issue is not an issue that's been elevated to the level you're trying to achieve in a church setting, unless it ends up being woven into the fabric of worship, and especially if you can make it a part of a sermon. So one of the things that I did for a year as a result of almost a foolhardy commitment I made initially, but for 1 year I made a commitment where every Sunday, there was a message that had to do with HIV. We need that same kind of spirit that's in faith communities and places of worship, where it's a commitment. And I hope that that's one of the byproducts of what we'll get out of our Faith Ambassadors initiative, is that we'll equip people with the right information that will allow them to be able to forthrightly speak to these issues every time they have an audience.
Dr. Taggart?
I echo many of the points that were made, and I think I would just add the importance of speaking to community resilience and stability and saying, you know, the importance that we as communities of color really work together and to pool the resources that we have and to stay in a space that isn't one that's constantly of the deficits that we do not have, but rather the resiliency and resources that do exist in order to really combat what's happening with COVID-19 and HIV, and really leaning on those strengths as we kind of continue to, as Michelle said, act up against some of these larger systemic and structural barriers.
And Dr. Graham.
Yes, there's many things that need to be done in the immediate time frame, but I also pray that there's a whole generation of 8-year-olds who dream about being viral immunologists and who rise up and have critical thinking skills and be able to lead us out of this, much as Dr. Kizzmekia Corbett, who works in my lab, has done over these last 15 years of training. So I just hope for that to happen.
Well, thank you. Thank you all for a very vibrant discussion about faith and spiritual communities and how we address COVID-19. It was just really a fantastic conversation. At this time, I want to turn it over to our very fearless leader, Dr. Robin Lancy, as she ends us with some closing remarks.
Thank you. And I just feel so blessed and thankful to be part of this wonderful discussion and all the great work that our panelists are doing and all of our communities are doing to really wrap our arms together and do what we can. And I just thank you all. Thank you, our panel members. Thank you, our great moderators. Through the Inter-CFAR Faith and Spirituality Research Collaborative, we've been really blessed to offer these summer webinar series, and this concludes our summer webinar series. What our plan to do is to take these 4 that we have and then a sort of Instagram live TV kind of one and share out with them, and we're going to plan over the next month for our fall series, and so that will be coming. And thank you all for joining us. And I'd like to kind of go off script and ask Reverend Sanders if he might close us in a prayer. I just feel it's just be a wonderful thing to end with the closing prayer.
We give thanks that the Creator of all that is has heard our prayer. Our prayer has been heard in terms of wisdom being shared. Our prayer has been heard in terms of encouragement and motivation and uplift, in terms of confronting this issue in a way that is not compromised by fear in any fashion. And we pray that as we go forward, we will take the spirit of enthusiasm, the spirit of dedication and commitment with us that allow us to continue to share these words of hope and allow ourselves to be examples of the investment of our total being into being part of what will solve this problem and will prepare us for that which might be before us. Amen.
Amen. Thank you again. Everybody have a wonderful, blessed weekend, and look forward to working together.